Right. So in the last session, we have discussed about HAX transactions, all this in reference to the healthcare. What are the different HAX transactions followed by EDI codes, right? So EDI transactions, which is called electronic data interchanges. All these were discussed in the last session. Now, today I'm going to discuss about the rating system, generally, which is called QRS, like quality rating systems, all in context to the healthcare system when we are using, right? So whenever we are working on uh, these uh, systems and all that, so quality systems when we are using, we need to understand these quality rating systems followed by the kind of information on different exchange health plans, what normally organizations, something like CMS and all, everything manages. So first of all, we need to understand in what way and how is this important, because the major goal of quality rating system is to increase the transparency and as less the competition by providing some comparative information for consumers and all that. Along with this, when it comes to the CMS, which is for Center for Medicaid and Medicaid Services, because whatever the Medicare and Medicaid programs, everything will be managed by CMS. And these CMS will administer all the ratings, like, because you can see like 1 to 5 star ratings, right? So all these rating programs, ratings, everything will be managed by it. The major intention behind this is to measure the overall quality of care and services which normally we provided as far as health plans are concerned, especially to the health plan members, etc. All that. In this regard, today I'm going to show you, explain you about the quality rating systems, where which can be divided into 4 different categories. One is about the member experience. Second one is called medical care. Third one about plan administration, followed by overall plan rating. So these are the 4 major areas and all. Member experience based in providing some member satisfaction with healthcare and as well as doctors and all that. So wherein if you want to get any kind of appointments and all everything. So this usually connects with member experience, whatever the member categories we have, everything comes under this category. Normally, as far as the rating measurements are concerned, because if you want to provide rating and all, we need to measure these methodologies, right? So what are the different methodologies we have, everything we need to access with. So in reference to the methodology, when we are talking about this methodology, can be something like member surveys with 10 different measurements, right? So what are the different measurements are we using, that I'm going to discuss in the next session. So wherein we can provide somewhere around 1 to 5 star ratings for that. Next, when it comes to the medical care, this is one of the category. Whenever there is any kind of plan network providers followed by managing the members in context to the healthcare, including is there any kind of providing regular screenings or vaccinations? At the same time, what are the different basic health services, monitoring conditions, right? So all these things are comes under medical care. This is exclusive for the patients, you know that. For this, the methodology somewhere around 28 clinical quality measurements will be taken in different variants, in different varieties. So for that, 1 to 5 star rating will be given even for that. Next, plan administration, because how are we managing the plans and all? How are we running those plans? Administering the plans, something like customer services, right? So access to the required and needed information, as well as the kind of network provider orders, right? So all these things are comes under comes under plan administration part. So this also includes whatever the required tests and as well as treatments which are appropriate to be provided, everything will be comes under this. Now, the kind of measurements in context to the methodologies we are using QHP enrollment survey. This is one thing which normally use. This majorly relates to the kind of customer services, right? So wherein to fill out the forms, right? So health plan explanation forms, everything. So that rating can be given, even 1 to 5 rating can be given for that. Next one about the overall plan rating, where when there are any kind of medical care categories are given, wherein we are combining some medical care or member experiences or any plan administrations, which normally used to create overall rating, right? So all these things are comes under overall rating plan is concerned, right? So normally when it comes to the methodology, we use weightage of scores in all the categories, because what are the different categories do we have? We need to manage all the categories is something which normally we need to do. This is something which we do as far as the overall plan rating is concerned. So further 1 to 5 star rating will be given. So these are the categories which normally we have whenever we are working on quality healthcare. So these are the different categories which normally we will be using to provide quality rating systems for the health insurance plans, what normally we manages, and which is administered by CMSs, all that. So tomorrow I'm going to discuss about how this administration functions, like how CMS, Center for Medicare, and as well as Medicaid services functions, in what way this will initiate the processes that I'm going to explain you in tomorrow's session.